Hi, good day, everyone. Today we are joined by Dr. Heylen from Cape Fertility. Dr. Heylen is no stranger to fertility solutions, and today we will be discussing fibroids and the effects it has on fertility. Dr. Heylen, before we start, do you mind telling us a little bit about yourself, please?
About myself, oh dear. Thank you,
Yes.
Rezhana, and thank you very much for the kind invitation. It's always a pleasure to speak to Fertility Solutions. So, yeah, I'm a fertility doctor at Cape Fertility. As you can hear from my funny accent, I'm not South African. I'm from Belgium. I was born, bred, and trained over there. And then I one stage met a South African girl who's now my wife for 34 years on next week.
Oh,
So,
wow.
yeah. So I'm now a South African in heart. Huh? And yes, I'm a fertility specialist. I specialize at Cape Fertility, and yeah, we do endometriosis, fibroids, polyps, and then obviously our field of interest is also IVF and all the related assisted reproduction that we do at Cape Fertility. And I've got four very wonderful colleagues who work with me at Cape Fertility. It's a very nice and satisfying place to work.
Yes. Thank you so much for that introduction, Doctor.
You're
So
welcome,
I'll
Anna.
just go straight into the first question. What are fibroids and what are the different types women should know about, especially in relation to fertility?
Yeah. So fibroids are growths from the uterus. It's a benign growth of the muscle of the uterus. So the uterus has got different layers. Got the inside layer, we call that the lining, and the outside layer. And then the biggest layer is actually the muscle. I
Mm-hmm.
mean, you can feel it when you've got your menstrual cramps, and that's also there what pushes the baby out, huh, during labor. And the muscle of the uterus can make a growth, can make a tumor, a benign tumor, and that's called a fibroid. Or
Yeah.
sometimes it's also called a myoma. So there's the same thing. If people speak about a myoma or a fibroid, that's the same thing. Now, because
Okay.
it's benign, it is fine, and it does not have to be, it's not necessarily a concern just because it's there. But it can cause symptoms, and the most common symptoms are pain and bleeding. So
Mm-hmm.
excessive menstrual bleeding, so heavy periods, and pain during the periods, and also sometimes pressure symptoms like pain in between the periods,
Yeah.
pressure on the bladder and on the bowel, discomfort during sexual intimacy. These are all possible symptoms. But most of the fibroids do not cause symptoms. They're just sitting
Mm.
there. And very often women come and they say, no, I'm fine. And you scan them, you check with the ultrasound, and you see the fibroid sitting there. Now, there are different types of fibroids, and there is a classification of the International Society of Gynecology. It's called the FIGO classification, FIGO. Okay.
Okay, that's
But
quite
that,
a
yeah,
mouthful.
it's quite a mouthful, yeah. But it just says that the fibroids where are sitting on the inside of the uterus, on the place where the baby must grow, and they're a lot
Yeah.
more significant than they are sitting on the outside of the uterus.
Okay.
So we have fibroids grade 1, they're in the cavity of the uterus, or grade 0, completely inside uterus, and up to grade 7, completely on the outside.
Mm.
So the higher the number,
Mm-hmm.
the less the impact on fertility.
Okay.
Yeah, so you've got a fibroid for that is called FIGO 4 or 5, for instance. That's
Yes.
not as bad as it 0 or 1.
Okay.
Yeah.
Okay.
So the where the fibroid is localized is very important.
Yes.
It's not the size that's the most important factor, it's the position.
Yes.
Because a small fibroid in the wrong spot can be more important than a big fibroid on the outside of the uterus. Huh?
Yeah.
So and that can, and I speak specifically for infertility. Huh? So small
Yes.
fibroids that are growing on the place where the baby must develop can be a significant problem for fertility.
Okay. That's quite interesting.
It is, yeah.
Yeah, Doctor, when you're ready, I'll move on to the next question. What symptoms can fibroids cause, and how are they usually detected during fertility or gynecological assessments? I was so
Yeah.
scared I was going to butcher that word.
Yeah. So, as I said, most women feel nothing. Yeah? So, a
Yeah.
lot of fibroids are asymptomatic and are discovered by coincidence. And between the age of 40 and 50, about 25% of all women will develop fibroids. It's very common. It's the most common
Mm,
gynecological growth. Huh? It's the most common
yeah.
tumor in women, huh? But it's benign, huh? So it's not a cancer.
Yes. And
So
are there certain races or
yes,
ethnic
yeah,
sorry, ethnic groups that it
yes,
resonates
yeah.
mostly with?
Yeah, we see that very often in West African women, women from Nigeria and these
Yeah.
surrounding areas, and in women from Angola. It's also
Okay.
extremely common in the so we have in Cape Town a lot of patients coming from Angola because the healthcare facilities are not as good as there in South Africa. And
Yes.
nearly all of these women have fibroids.
Yeah.
It's in Portuguese, it's a myoma, huh? So, and the women know that, and if you scan them and
Yeah.
says no myomas, they're so happy. So
Yeah.
it's just, yeah, it's a very, very common thing over there. So
Yeah.
yes, it's more common in certain African groups, but it can happen in all groups. So
Yeah.
in European or Asian women, it's also quite common. And as I said, between the age of 40 and 50, it's one woman in four will develop
Wow.
fibroids. So it's very, very common. I'm
Yes.
going to reject that call.
Oh no, it's all fine, doctor.
Yeah,
Okay, so my
yeah,
next question is, how can fibroids interfere with natural conception or IVF, and which types are most likely to impact infertility or pregnancy outcomes? I know you've touched on it a little bit
yeah.
earlier
I've touched
in the
touched on it. Yeah,
conversation. Yeah,
yeah.
yeah,
So fibroids, they can cause symptoms and they
yeah,
can cause infertility. And I usually see the patients because of infertility, but I also see them sometimes because of symptoms. Sometimes I get
yeah,
referrals. Just I've got a patient with a fibroid which causes excessive menstrual bleeding. Can I please do surgery
yes,
for that? So that's also
yeah,
possible. But it's usually fertility, and it is then the position is more important than the size. But the size is
mm,
also important. The bigger the
yeah,
fibroid, the higher the chances that will impact fertility. And some
yeah,
fibroids can completely destroy the uterus, can completely have a
yeah,
malformation of the uterus. So, I mean, I'm just coming out of theater and I
yeah.
have removed six fibroids from one lady. But 2 weeks ago, we had three patients that I took to theater. And in total, out of these three ladies, I took out 100
Wow,
fibroids. Okay.
wow.
Yeah.
That is
So all of them
certainly a
had like
lot.
20, 30, 40 fibroids. So that was,
Yes.
yeah, it was a long day for us. Um,
Wow.
so it is something that is quite common and can cause the
Yes.
symptoms of
Yeah.
pain,
And doctor, what?
abnormal uterine bleeding, and
Yes.
infertility.
What causes fibroids? I mean, I
I
know
don't
we're
know. Yeah,
talking about all these things, but like, and
yeah.
it's so common, but there's still no, like,
There
what
is
is
no
the
specific
explanation
cause
for
of
it?
that. Huh? Yeah.
Yeah.
So there is definitely a
Okay.
genetic component. Huh?
Yeah.
So if you spoke about certain groups, so that's the
Yes.
proof that there is a genetic component. And
Yeah.
we also see it in clusters. So if somebody in your family has it, then it's got a higher chance that you have it too.
Okay.
It has also something to do with delayed pregnancy. So women that have a baby when they're very young have less chance of developing
Okay.
myoma. So, but the specific cause, we don't know. It's not like if you have got COVID, we know it's caused by that virus. Okay,
Yes.
that's a link. Or if you've got a lung infection, that's caused by that bacterial infection. Then we know the exact cause. But for fibroids, we don't know. We just know that it has to do with genetics. But yes, then it just happens. And I wish I could say there's a
Yeah.
specific cause for that we could treat it, but we can't. Okay.
Yes.
So we
Yes.
cannot treat the specific cause of fibroids
Yeah.
because we don't know.
Yeah.
Yeah.
Okay, so now we talk about treatment options. What treatment options exist for women who want to conceive, and how do you decide between medical management, surgical treatment, or proceeding directly with fertility treatment? I know you also touched on it a little bit earlier in terms
Yeah.
of the not the size, but the location.
Yeah, yeah, absolutely. So if you look at medical treatment medication, there is not a lot for fibroids that we can do to treat the fibroid effectively.
Yeah.
But there's a lot that we can do to treat the symptoms of the fibroids. And then we're looking at pain and bleeding, huh?
Mm.
So for pain, we can give anti-inflammatory medication during the periods, which works brilliant. It also reduces the amount of bleeding. So for bleeding and pain control, we can just prescribe birth control pills because birth control pills give a regular cycle with less bleeding and less pain every month. So women have got painful periods because of fibroids. If they take a birth control pill, that very often can work. We can use something which is called Trenic or
Mm-hmm.
cyclopentone. That's a tablet that we give, and that can reduce the amount of bleeding that women have. We can also give sometimes progesterone that can be given by oral way or by something that's inserted in the uterus, a Mirena loop, huh?
Mm-hmm.
So that can also help. We can sometimes also give injections with a hormone that brings a woman in an artificial menopause. That sounds horrible. It's a bit
Yeah.
horrible also.
I've been there.
Because it gives the hot flashes and
Yeah.
all the other associated menopausal symptoms. But there are new drugs coming on the market that have add-back treatment that
Okay.
the side effects are not as bad or not there anymore. So yes, there is in medical treatment, there is some evolution coming.
Mm.
Um, a few years ago, like 10 years ago, there were very effective selective progesterone receptor modulators, what's called, available, but they have been taken out of the market because they cause, in rare cases, liver damage. Huh?
Wow.
So that was a good option,
Yeah.
but it's not available anymore.
Yeah.
So from a medical treatment point of view, it's more like symptom control that we speak about, controlling the pain and controlling the bleeding. And there are few drugs that can shrink the fibroids, and these are these drugs that create the artificial menopause.
Mm-hmm.
And now with newer technologies, we can avoid the side effects of these artificial menopause in women. So we've got some good progress over there.
Mm. Yeah.
That's from a medical point of view. Then I've got a
Yes.
surgical point of view. Got lots of options. Huh? Yeah, yeah. So the conventional treatment way is the laparotomy. That means you make a cut like a cesarean section, huh?
Mm-hmm.
And you go to theater, and that's what I've done this morning. And that's typically done for women who've got a lot of fibroids. They've got multiple fibroids and they're
Mm.
big. Huh? So you've got 10 fibroids, I mean, and they are big, then the best way to do is to do an incision like a cesarean section. And then you've got the other options, which are the minimal invasive surgery options. And that can be done by laparoscopy or by hysteroscopy.
Mm.
By laparoscopy means a look in the tummy. Hmm? So a gastroscopy means a look in the stomach.
Yeah.
A laparoscopy means a look in the abdomen. So make an incision in the navel and you put in a scope. And then you can see the liver and the gallbladder, but also the uterus. And through that technique, you can also remove fibroids. You make just a few small incisions in the abdomen. It's called minimal invasive surgery. And with that technique, you can also remove fibroids. Not when there are 20 fibroids, but when there are 1, 2, 3, 4, and they are not
Yeah.
huge, they're 20
Yes.
centimeters. Yes, it's definitely possible. And it is better for fertility and it gives faster recovery. So the minimal invasive surgery, the laparoscopic one, is always the preferred one if it's technically possible.
Mm.
And then the hysteroscopy means that you look through the vagina inside the uterus. That's a very small operation, but you just stick a camera inside the inside of the uterus, and then you can remove these fibroids that are there in the place where the baby must grow. Eh? I was saying the position is important. So
Yes.
these fibroids that sitting on the inside of the uterus, they can be removed with a hysteroscopy, which is even less invasive than a laparoscopy, because a hysteroscopy, most women are fine after a few days. A laparoscopy, most women are fine after 1 to 2 weeks. And if you have to do an operation like a cesarean section, the recovery takes 4 to 6 weeks. So that's, I mean, that's different from the type of surgery. So you've got a laparotomy, then a minimal
Mm-hmm.
invasive one, or through the tummy, laparoscopy, or the hysteroscopy.
Yeah.
And then there are the even less invasive ways. And there are three, okay? You've got the
Okay.
uterine artery embolization, you've got the RFA, radiofrequency ablation, and the HIFO, that's
Mm.
also a newer
Okay.
technique. I'm not going to speak about the HIFO because I don't think it's available in South Africa yet. Um, but that's a technique where with ultrasound kindness, you destroy the fibroids. It's a pretty expensive technique and it's not that effective, but it is really very non-invasive. Then the uterine artery embolization is a very good technique that a radiologist basically plugs the arteries that go into the uterus, and therefore the blood supply of the
Mm.
fibroids becomes less, and therefore they start shrinking.
Yeah.
And that's a very good technique, but it's not the ideal technique in women who still want to have a baby. So
Mm.
that's perfect for women who are past the childbearing age and
Yeah.
have got, especially got a lot of fibroids together, where surgery will be quite difficult and dangerous for the women. So the uterine artery embolization will be a much safer option for them, and they can shrink the fibroids, and the symptoms can become much better. But it's not typically recommended for
Yeah.
infertility.
Yeah.
And then we've got the new kid on the block, huh? That's called
There's
the
always one.
yeah, that's called the RFA. It's a radio
Yeah.
frequency ablation. That's a technique where we go like an egg retrieval. We go with a needle through the vagina in the
Yeah.
fibroid and we basically cook the fibroid.
Oh.
Yeah, it's very cool.
It doesn't
And-
sound cool, but I'm sure it helps
Well,
and is effective.
it's cool for the doctors.
Yes. It sounds
We
quite
always, yeah,
scary as the patient.
yeah, we like our gadgets, huh? Yeah.
The tech
So
guys have the IT projects and you guys have your gadgets.
yeah, so this is a technique that is actually very non-invasive because we don't cut,
Okay.
huh? As there's
Yes,
no
yes.
cuts, there are no stitches. It's done
Yeah.
like taking out the eggs of a for an IVF patient,
Okay.
and the women can go home after a few hours and they recover in a few days, huh?
Oh,
And it's also very useful for infertility. So
okay.
there have been hundreds of pregnancies described after that, and it seems to be a very safe procedure for
Yeah.
infertility. There's also got some limitations in the sense that you can only do a certain amount of fibroids. There don't have
Mm,
to be too many fibroids, and they
okay.
don't have to be too big. Huh? So,
Yes.
um, but it's for a limited amount of fibroids that are not too big. It's a very good
Okay.
technique. Yeah,
That was
and
actually my
it's
next question is who would be a candidate for that kind of treatment?
yeah. So the
So,
RFA would be a woman with, let's say, three, four myomas, or maybe one, and
yeah.
that are not 10 centimeters, but maybe 4, 5, 6
Okay.
centimeters. And obviously, they have to be very good, very well visible with the vaginal ultrasound. It's done under
Okay.
anesthetic, and it's much less invasive than even a
Yes.
minimal invasive surgery. Huh?
Yes.
Um, and the follow-up studies that have been published, and it's mainly in Europe have they been published, have been very, very good and very reassuring for women who like to conceive. So
Mm,
it's got not this damaging effect
yes.
like the uterine artery embolization can have. Uterine artery embolization for women that trying to conceive can have an effect on the lining of the uterus, so the place where the embryo must implant,
Mm,
and on the what we call the ovarian reserve, on the amount of eggs. So, but the RFA, the radio frequency ablation, the new kid on the block, doesn't have these these issues. And it's
yeah.
even less invasive than a uterine artery embolization.
Okay.
But it's not suitable like uterine artery embolization for women who've got lots of fibroids. So
Mm,
women with lots of fibroids,
yeah.
the RFA cannot be done.
Okay.
There are some
It's
technical limitations
obviously
of
a
that.
good case by case basis, and you will then
Yes,
decide
yeah, yeah,
what would be the optimal treatment
yeah,
for the fibroids.
yeah, yeah. So yeah,
Okay.
so there's new treatment options that are coming now, and that especially at RFA, I think can be a game changer for lots of women
Yes.
with fibroids.
Still trying to conceive.
Yes, for trying to
Yeah.
conceive. Yes.
Yeah. Yeah.
And not only you
It's,
trying to conceive, also women who have symptoms,
mm,
um, and just have got, they don't try to conceive, but they've just got excessive bleeding, or got painful periods because of the myoma, and that is also a good option to do. Yeah.
yeah. Okay, thank you very much, doctor. And my last question to you is, after treating fibroids, whether surgically or medically, what is the typical outlook for fertility and for achieving a healthy pregnancy?
Yeah. So then again, huh? So it's not because there is a fibroid that we must cut it out or we must do something about it. Because a lot of women, I would say the majority of the women,
Mm,
do conceive without problems, and they have pregnancies without problems. So
mm,
it's very important to understand that's not because there is a fibroid that it
yeah,
can will cause a problem. Because if it's not in the difficult position,
yes,
if it's more on the outside, then
yeah,
it usually does not interfere with fertility. And it also does not interfere with pregnancy. It doesn't cause
yeah,
more pregnancy complications. So the fertility prognosis is for many women not too bad.
yeah,
And once you've removed fibroids, then again, the fertility prognosis for a lot of women is quite good, as long as we can restore a healthy inside of the uterus.
mm,
So the cavity of the uterus, again, the place where the baby must develop, not the outside of the uterus, the inside of the uterus must be restored to normal.
yeah,
There is an increased incidence of cesarean sections. Yeah. So some women will need a cesarean section.
yes,
Yeah. And it is not a good idea, especially after surgical removal, to conceive in the first 3 to 6 months after surgery, because then there is a small chance that the uterus will rupture
oh
during
wow,
labor. Yeah,
yes.
that can happen.
So
So women
after
have to be,
surgery, there
yeah,
is, and
yeah,
with the new RFA treatment that
same.
you discussed, the same. Okay.
Same. Yeah, that's the same. Okay. Also, the 3 to 6 months waiting time before a woman is allowed to conceive. So that's exactly the same. For all the different surgical techniques, it's the same, except for the hysteroscopy, because that's usually only small
Mm,
myoma on the inside of it, and sometimes the waiting time is only 2 months.
yeah.
Yeah.
Thank you so much, Doctor. If there's anything that you want to add to fibroids and the discussion, please feel free to do so.
Yeah. So it's not something that we should really be always scared and worried about, because fibroids, they're not always a problem. And in the majority of the women, they are not a problem. Huh? So the majority of the women who have got a fibroid, they've got no pain, they've got no excessive bleeding, and they've got no fertility issues. So we can just leave. So sometimes I scan
Mm,
and say, oh, there's a fibroid, and they describe it to endorse it, but please forget about it, because it's not going to cause any problems. The thing is that sometimes they can grow and develop, and then later on in life can cause a problem. So, but it's important to understand that it's not because there is something, it must be, we
yeah.
must do something about it. And then secondly, that both from a medical point of view and from a surgical point of view, there are new kits on the block coming. So we can do more and more, and we've got more options and less, very important, less invasive options for
Mm,
women available. And the medical treatment, we've got game changers coming. And for the surgical treatment, we've got game changers coming, so that we really can offer women better
yeah.
health care and better options. So it's exciting developments, and we can always try to
Yes.
help women better and better
Yeah.
with their problems of fibroids
Yes.
and their desire to have a baby. Huh?
Yeah. It's good to know that women have options these days.
Yes, more and more options.
Yeah.
Absolutely.
Yeah.
Yeah, that's
Yeah.
one. True.
Thank you so much, Dr. Helen.
You're
Thank you for joining
welcome.
us today,
You're
and
most
we look
welcome.
forward to seeing you again on Fertility Solutions.
Thank you so much. I'm looking
Okay.
forward to it. Take care.
Yeah.